Welcome to Ortho Eval Pal, where we help you build confidence in your orthopedic evaluation and management skills.
All right, well, I'd like to welcome you all today. Here we have Jonas, who sustained an ankle injury about 1 week ago when he was playing hockey. He went to try to stop himself, and his skate caught like this, and his body went backwards like that. And therefore, the skate pushed really hard into the lateral side of his leg, right into the fibula, and he sustained a considerable amount of pain. Next morning, came in to the clinic, had difficulty weight bearing, and most significantly had pain when he was weight bearing and turning and twisting. When he first came in, we didn't notice a lot of swelling. As you can see right now, there's very minimal swelling around the lateral fibula and no significant swelling intra-articularly. You didn't have any numbness or tingling at the time? Nope. Any popping, snapping at the time of the injury? Nope. That you remember? No? Okay. And he did report immediately having some difficulty dorsiflexing the foot. Plantar flexion is a little bit tight also. And where do you have most of your discomfort?
Right around the malleoli and the anterior portion right there.
Okay. So a couple things that we did when we first saw him was check his range of motion. And he gets to just above neutral right there. Any pain with that?
Yeah, that starts.
Okay, so he starts to get some discomfort there. Plantar flexion.
Right there.
And where is your pain? Okay. So it's up a little bit higher than the common ankle sprain. Typically, your inversion ankle sprain type injury will be through the ATF area here. Calcaneofibular ligament, you can see it's nice and tight right there. And then the posterior tib back here and talofibular ligament, and he's not having any problems there. So the first thing we're going to check is his stability to see if his ankle is good and stable. And his is. Originally, we checked the other side, and it's equal. The other thing we're going to do is we're going to test the ATF, give him a little plantar flexion and inversion. Any pain with that? That's not too bad. So a common typical ankle sprain, inversion ankle sprain, would present with a lot of inflammation, irritation, swelling there, and pain when I do this test. Now I'm going to perform a Kleiger's test where I take his foot and I'm going to plantar flex it a little bit. I'm going to evert it. I'm also going to hold him right here. As I do that, you can see he has a considerable amount of pain with that. Now, where is the pain when I do that?
Right in the same spot, right up here.
Okay, so it kind of goes up just medial to the fibula. Next, what I'm going to do is palpate between the tibia and fibula. And that's really painful.
Mm-hmm.
And it starts, we're still sore here, but it starts to decrease a little bit. Right in that area. We're going to do a bump test. Any pain with that? We also did a tuning fork on his fibula when he first came in and didn't have any considerable pain with that. We also checked his pulses and those were fine also. He's having no obvious neurovascular dysfunction. The other thing we checked was his fibula all the way up and down to make sure that he doesn't have a Mazenou's fracture, which is common with ankle sprains, where you sustain a spiral fracture of the fibula. And oftentimes, we just x-ray this area that was injured and neglect the rest of the tibia and fibula, where you can also have a secondary fracture. So we had Jonas we put him immediately into a walker boot to immobilize him. That increased his ability to walk, significantly decreased his pain, and also sent him to orthopedics, where he received an x-ray to find that he had no fractures and had the diagnosis of a grade 1 high ankle sprain. And so the way we're going to treat this is we're going to immobilize him in a boot for a couple of weeks and then start to progressively get him back to a weight bearing, probably with a lace-up brace, with controlled walking and all straight plane activities, and really not encourage any weight bearing or twisting and pivoting type activities just yet. And that's how we're gonna progress with Jonas.
We hope you've enjoyed this video, and for more awesome content, go to orthoevalpal.com. Can't wait to see you there.